Watch, do you need an annual checkup?
Well, medical reporter Dana Bear is here with the do's and don'ts when it comes to doctor's visits.
From blood work to a complete physical exam, many patients want the works. But what's really necessary each year? A group of physicians has some surprising and practical advice.
Not everyone needs an annual checkup.
That's the key message from Northwestern medicine researcher David Liss, who helped craft new guidelines from the Society of General Internal Medicine.
When you do go in, you don't necessarily need a physical exam.
Instead of an exam, think of visits as checkups, and that checkup may not include a comprehensive physical exam or routine lab testing.
So when you talk about unnecessary testing, you can often have false positive results. And when you have false positive results, that can lead to more testing. Patient worry, patient anxiety.
So who should get annual checkups? People ages 65 and older top the list, as well as those who are overdue for recommended preventative care, patients at high risk of undiagnosed chronic illness, and those who rate their health as poor or fair.
So in these groups, there's a lot of reason why annual checkups can be quite helpful.
There are some basic tests and preventative screenings that are recommended for otherwise healthy or asymptomatic patients. Get your blood pressure checked and have your body mass index assessed. If previous blood work lab results were normal, have your blood glucose and lipid levels checked every 3 to 5 years. All patients should stay up to date on vaccinations and cancer screenings. That includes colonoscopies and cervical cancer screening, plus mammography for women.
People who are already regularly getting primary care, there's a good chance that these many conditions are being detected.
When it comes to unnecessary procedures, according to the new guidelines, there are several patients can skip. The physician group does not recommend daily home glucose monitoring in patients with type 2 diabetes who are not using insulin, routine preoperative testing before low-risk surgical procedures, cancer screening in adults with life expectancy of less than 10 years, peripherally inserted central catheters for patient or provider convenience.
Unfortunately, there can be a lot of harm that can sort of result from some of these kinds of tests.
The recommendations are part of the Society of General Internal Medicine's Choosing Wisely campaign. We have a link on our website. Back to you.